today for this webinar session. And I am truly delighted to have the honor of introducing our guest speaker, Dr. N.B. Srikanth sir. Sir is BHMS MSc Psychology, practicing since 20 years, student at Swara Gurukul since 2018, completed TTC in 2022, spreading knowledge of homeopathy under the Sankalpa Homeopathy Academy online education under Sir's guidance. In previous lecture, Sir also gives knowledge of what is to be observed while treating sick and how to apply Materia Medica clinically. And today, Dr. Srikanth sir discuss about medicine of Ranunculaceae family. So without further delay, I am invited you all to join me in extending warm welcome to Dr. Srikanth sir. Welcome, sir.
Yeah. Good morning, ma'am. Good morning, each and everyone.
Good morning.
Yeah. So without further delay, we will go with the understanding of Ranunculaceae family. Okay. So the main idea of homeopathy is to select a proper simillimum. You all know that you all had been taught about this in your academic education. So to get into this crux of thing, there is a study happened from the masters itself to study remedies by a group idea. So studying remedies together, and this idea will give us a more proper understanding about each and every remedy that belongs to the group. So at first, we will discuss the taxonomical classification. You all know the taxonomy of a particular thing. So the Ranunculaceae family comes under the kingdom Plantae and class Angiosperms and subclass Magnolidae, order Ranunculaceae and family Ranunculaceae. This is the taxonomic idea of the Ranunculaceae family, and the genus and species will be named after the remedy which we will take from the family. If it is Pulsatilla, Pulsatilla nigricans. If it is Helleborus, Helleborus niger. If it is Aconitum, Aconitum napellus. Like that, the genus and species will vary. But this taxonomical classification by the botanists will give us a proper picture about the family Ranunculaceae. And now in the future studies, the newer studies of homeopathy, the newer horizon of homeopathy about the subclass and superclass, understanding this taxonomical classification is playing and will play a very vital role in understanding about the remedies. So, dear friends, please keep an eye about not only studying the remedy, but also from which source it will come, and from which order it will come, and from which family, and from which class, which subclass, and which kingdom. Later on, about studying the remedy in this way, will give us a proper portrait not only about the patient whom we are dealing with, but also the idea of why this particular symptom is present in this remedy. Because we all know that these aconite, pulsatilla, or Staphysagria, any such sort of remedies, ignitia, naxvomica, arnica, chamomilla, cinna, like many remedies. If we study these remedies together, we had a proper knowledge that all these remedies from plant kingdom, from kingdom Plantae, has so many modalities. So if you study a lot of animal remedies like apis, lecasis, plata, like these many remedies, if we study from animal kingdom, like caninum, then we can understand that all these remedies from animal kingdom has modalities, but not up to much extent. And all these remedies has something concerned with the idea of I versus you. Whereas we see the remedies like natramur, the remedies like sulfur, for example, arum, argentum, palladium, many other, calcarea carb, calicarb, like so many remedies. When we study these remedies, we can understand that all these remedies which belong to the mineral kingdom has something to do with this idea of sharing, with this idea of structure, with this idea of something lacking or something losing, which gives us that a proper emphasis of mineral kingdom, and the idea is lacking or losing. So studying these sort of things like this will help us to understand not only about the remedy which we are studying, but also a proper backdrop of why these things will happen in that remedy. Why a natramur has the issues with relationships. Why the pulsatilla plant has so many things with the adaptation idea, with the idea of adaptability. Why the lecasis patient has this revengefulness, has the loquaciousness. So we will get the symptoms, and along with when we study this idea of remedies studying together, we get a proper knowledge that why this symptom is present in that particular remedy, which gives us a more deeper understanding about the remedy and as well as the personality whom we are dealing with. So dear friends, please understand this idea of how we are going to manage or learn about the remedies and also about the source from which they come from. Okay. So our master, one of the master of homeopathy, John Henry Clark, you all know about him, the Dictionary of Practical Material, a monumental work by the master. So he says that our agents are forces of higher nature and we should treat them as such. So whatever the medical agent, the remedies, the pulsatellas, the apis, the lecasis, all these remedies which we are dealing with, remember dear friends, they are not only a physical remedies, but they are source of some dynamics involved in them. And these are the higher nature forces. Not only nature, but higher nature forces. So we should treat them as such. Whenever we are going to learn about a remedy or write about a remedy or talk about a remedy, there should be a filament in our brain that should immediately light up and should make us learn that this remedy which we are dealing with, which we are thinking, with which we are learning, with which we are talking, with which we are writing with, is not a simple alphabetical form, but it is a force of higher nature. This should be a habit that should be culminated, that should be habituated by the homeopaths and especially the students, dear friends. So this idea of studying drugs in this way, in this relationship form, in the Materia Medica was first given by Ernest A. Farrington in his book of Lectures on Clinical Materia Medica. Hope you all had a knowledge about this book. If you didn't have, please immediately go and buy this beautiful book, which clearly emphasizes the need of studying the remedies together. In this book, at various levels, the author makes the student understand that how should we study the remedies by this grouping method and what are the advantages of studying like this, and at the same time the minimal differences between the like remedies, etc. All these were taught way back before we even know what this relationship is. It is taught way back by our dear Farrington. So please, in your BHMS, it is a book that must be read by all the homeopaths. So dear friends, if you are not well versed with this book, my kind suggestion is you please read this book and get a proper understanding about the group study of the remedies, not only the single, the Ellen's, the herring guiding symptoms like this, the Kent, etc., but the Boric, etc. But the must-read book is this Clinical Materia Medica, where you can get this idea of studying remedies together. What is the relationship between the like remedies? What is the idea of family understanding? What is the idea of Ophidian understanding? Different snake remedies, different cationic remedies, different anion remedies. Like this, he gave us electropositive, electronegative. He gave us a good understanding about each and every group so that we didn't confuse about what is to be taken in different remedies. So please go through this. And this idea of the name of the family, the Ranunculaceae, the name was derived from the different varieties of buttercup. This is one of the plant in this family, the Ranunculus bulbosa. So this idea, this different varieties of buttercups was the idea for the nomenclature that was put as Ranunculaceae because of these different varieties of buttercup. The members of this family, hope I know, because many of you are well versed with the remedies. The members of this family, they are Aconitum nepellus. You all know aconite, I think, the first remedy that can be taught in our BHMS, etc. Helleborus, Clematis erecta, Peonia, Pulsatilla, Hydrastis canadensis, Staphysagria, Actea racemosa, Actea spicata, and Ranunculus bulbosa. So these are the few members of this family where we had a good amount of provings. To some remedies, they are very much polycrest like Pulsatilla, Staphysagria, and other remedies had a lesser proving but has a very good affinity in the pathology of the different diseases. So these are some remedies. Okay. So we start with our favorite drug, Aconitum nepellus. So the common name is monkshood, wolf's bane. You all know the idea of aconite. So Kent, in his lecture, what the master had said about aconite in his lecture, that it is like a great storm. Kent says that it is like a great storm. The aconite indications will be like a great storm. It comes and sweeps over and passes away. It just sweeps over. Such is the pathological conditions where aconite was indicated and going to be indicated. The idea is like that a great star comes and sweeps over and passes away. By a little meditation. So how wonderful he used the words in those good olden days. By a little meditation, because we have to meditate to understand the idea of drugs, the idea of our remedies. We should know the portrait of that remedy. We should know the pace. In the last session, we discussed that Kent emphasized the idea of the pattern, the speed, the velocity, etc. of each and every remedy. In Baptisia, we discussed that thing. Likewise, here also, he is emphasizing the homeopathic aspirant to study remedies by doing some meditation. Because by meditation, what happens? We will imagine that particular remedy. We will have a pulse. We will palpate that remedy by doing a proper meditation. What is the nature of this remedy? And what is the nature of the sickness in which this remedy is going to be indicated? So these two things a homeopath will get understood only by doing a proper meditation, so that a clear picture will be seen in his own eyes. Okay. We will discover what kind of sickness all this is like, and what kind of a patient is likely to have that short sudden sickness. So in which cases we will have this idea of short sudden sickness. This is the thing Kent want to emphasize, because if we know the idea here by doing some meditation, what is the nature in this remedy, and if we know the sickness, we can match them together. This is the topic actually I dealt in the previous session also, the idea of sickness and the idea of the remedy and matching them, the adaptation technique. So in the same way here also, Kent clearly emphasizes that this idea should be taught and this idea should be habituated. This idea should be cultivated by a homeopath to get the understanding of a particular remedy. Aconite sicknesses comes down in plethoric individuals. So these are not weak, cannot be aroused on the bed. The weakness is stamped in the face like China, acid falls, such sort of remedies. So this is not such sort of remedy. It is a remedy where it is indicated in plethoric individuals, full of blood. They are of blush. They are plethoric individuals, full-blooded individuals, strong, robust people. Rugged children and infants become sick, not a very slight cold. That this is another beautiful theme of aconite. In some remedies like Dulcamera, you see that a sudden cold night, a person goes out to have some breath in open air and will come back. That short span of 5 to 10 minutes of exposure will bring down something called cold, sneezing, allergic rhinitis, all these of things in that particular drug called Dulcamera, which comes from Solanaceae family. But the aconite causation will not be like that. It is not a short span of exposure. It is a continuous exposure, a violent exposure. So in that cold, dry night, doctor, I had traveled all the way in the train in the night with exposure of so much cold wind. on my face. The window was open and I am exposed continuously all throughout the night to that particular cold wind. And immediately after reaching my town, I got this cold, throat pain, sore throat, high temperature, etc. And if you look at the physiognomy of that particular person, you can understand he is not a weak person, but a robust, plethoric person. So this is the way you understand the aconite picture, where it can be indicated. What is the pace? What is the amount of quanta that was given as a causation? It is not a slight light knot. It is a continuous violent exposure. And the pathology which is going to be developed is also violent. It is not like morning 99, at afternoon it will come to 100, at evening it will take on that 102, and the next morning it is 104. Not such a slow, steady way of appearing symptoms. The moment he will get temperature, it will get where it is about 101 or 102. Within span of 5 to 10 minutes, or within a span of 1 hour, things seem to be dreadful. Such stormy thing will be there in aconite. A vigorous person caught out with thin clothing, remaining out in the cold, dry air in winter, with sudden violent changes, come down even before night with violent symptoms. So here, just what I told just now, the way he narrated that. This is the class of patients. So you have to remember where the aconite can be well indicated. What is the nature of sickness? So simple fever, aconite does set typhoid, baptisia, dengue fever, belladonna, malarial fever, China. Those things will not be worked out in homeopathy. Remember, dear friends, the pathology never determine the homeopathic remedy. It is the nature of the sickness. Forget about the pathology. It is used only for the prognosis, to explain the patient that it will take this time, but not for the selection of the remedy. Those sort of prescribing is, Kent says, a foolish way of selecting remedies, selecting on the basis of pathology. Instead, you have to study the symptoms, the nature, the velocity, the pace, the pattern, the wave-like thing of that particular sickness. And we have to study the remedies also in the same way, so that we can later fix this sickness with this particular remedy. That's what Kent emphasizes here. The plethora and vigorous, who have strong heart and active brain. Look at baptisia. What had happened? We had previously discussed in our last session. So what happens with baptisia? The baptisia patient was down. He will not answer the questions. He is such in a state of stupor. Srikanth, like this. He will do all sorts of gestures on the bed. But the answering pattern is very poor. He is partially unconscious. He is in a drowsy state. He is in a stuporous state. Whereas in aconite, if you say something, he will, even in that fever also, he will immediately reply, no, I am okay. I have 102 fever. Like that. The idea is that there is a strong nervous system. The nervous system is not affected in aconite, but in the proving the baptisia are such remedies of a zymotic origin, the ailanthus, the baptisia, the pyrosinum, all these legacies for that matter, all these remedies which has some zymotic nature in their understanding, in their proving, will come with such sort of sickness. The moment the fever comes, they enter into this zymotic state, the stuporous state, the drowsy state. Whereas in aconite, the idea is that with this high grade of inflammation, like belladonna, for that matter, the nervous system is very strong. The persons are very plethoric. The persons are very strong. There is a stormy kind of symptoms and there is a violent exposure, and the brain works perfectly well in that vigorous idea and comes down suddenly from violent exposure. So that is the nature of sickness in aconite. So when we study the mind, how beautifully the mind was described in aconite. See, the idea of fear of death predicts the time of death. Most of you know this symptom. So the difference between arsenic and album and aconite you study in the BHMS. So it will be given in the papers also, question papers also. Fear of death and predicts the time of death. Such is the nature in aconite. So much fear, so much speed, so much stormy that he cannot wait. The idea of claustrophobia, agoraphobia, so many phobias in these aconite patients. Panic disorders with recurrent episodes of tremendous fear of death. So in some mental insanity cases, I had very few cases where aconite was indicated. It looks like stramonium in these sort of insanity cases. So in those sort of panic disorders, a personality disorder where the psychologist cannot do anything, in those sort of acute episodes of this panic problem, this remedy is going to help you wonderfully. So it is a chronic way of prescribing, but for that particular short phase only. Remember, dear friends, in mental diseases, usually we have lucid intervals. So patients are normal in those lucid intervals and something tricky comes up and they come with a violent set of symptoms. And we have to select a remedy in those spans of some violent acute nature like aconite, like belladonna, like hyoscyamus, like stramonium, like apis mellifica. So all these sort of remedies with very stormy, speedy action will come into picture in those acute phases of insanity. But once that period was over, then they should be followed by the chronic remedies. And we have to select, make a proper case sheet, talking with the patient, and if it doesn't help, talking with the attendants, make a proper case sheet, and after that acute interval is passed away, you have to be ready with your chronic remedy. Otherwise, these things will come on repeating. So whenever such acute episodes are there, even in chronic conditions, aconite can be indicated. That's what Kent says here. The anxiety following a strong fright. So usually aconite ailments, not only with violent exposure to the environment, but also sometimes have a violent exposure to the fright. Even in this condition also, it is a continuous violent exposure. So a person may see a horror movie, a child of plethoric personality. So he saw something, a movie called Conjuring for about 3 hours in the midnight, and immediately he caught down with some acute violent inflammation symptoms of head, brain, fever, etc. Then this remedy will come in to help you. So not only the violent exposure to environment or the society, but also the violent exposure to these sort of fright causations. Aconite will come into handy in those sort of cases. Panic, frenetic with pains. So in some acute conditions, the trigeminal neuralgias, suppose, or some cancerous cases. I tried Aconite in some cancerous cases, pains, violent pain. Patient couldn't sit quiet, tossing, a kind of mental restlessness, fear, death, panic, fright, frenzy. So all these sorts of pains will be there in Aconite. And remember, if you know the nature of the sickness, you can reach out the nature of the remedy. But you should know that what is this remedy? What is the pace, the velocity, the speed of this particular sickness? And which remedy will be suitable? Which remedy is there in our materia medica or in our repertoire? So that is very much ideally suitable for this sort of sickness. This is the thing you have to select. And Aconite is ready even in that violent cancer pains if all this mental picture is there. In trigeminal neuralgias, patient is frenzy with his pain. The same thing happens with the cheek, the mandible, the maxillary area, the parietal area, the eyebrow, the forehead, the sinus conditions, the migraine conditions. In all these sort of acute panic attacks, not in chronic stages. You cannot think of chronic. When it is in acute episode, then immediately you can turn to the Aconite, and this wonderful remedy is always there at your doorstep to help you. It is our duty to get enlightened into that particular thing so that it will serve wonder in your hands if you have a thorough knowledge of the remedy. So now the relationship with other remedies for this Aconite. So as usual, because all these are co-sisters and brothers, they all belong to same family. A lot of similarities we can find with other Ranunculaceae family members like Actea resmosa, Actea spicata, peony, Staphysagria, Ranunculaceae bulb, etc. But you can understand the difference lies in the speed and velocity. Suppose you see a Staphysagria patient of the same family. He has no such violence like Aconite, but he has a strong control over his mind. A sort of controlling mechanism in the chaotic situation. Whereas in Aconite, there is no such sort of control and everything is stormy, speedy, fast. Later on, masters like the Shankaran sir, Shekhar sir had formulated this idea that keeping on remedies according to the miasm. This will be dealt in the sensation understanding that the same family which has so speed, pace in its sickness comes under acute miasm. So Aconite is termed as a remedy from acute miasm of Ranunculaceae family, whereas Staphysagria with its control in chaotic condition, everything is suppressed. So will give us that the Staphysagria belongs to the cancer miasm of the same Ranunculaceae family. I don't know whether you are versed with the sensation understanding or not. I don't know exactly, but still what I want to know all of you is to understand this sickness in the proving so that in later part, a newer thoughts, a newer horizon may come into your own mind also. So, dear friends, be well versed with understanding the sickness and understanding the remedy. So, usually Aconite conditions are followed by sulfur. You all know that sulfur is a natural chronic of Aconite. It is termed as the complementary and chronic for aconite. So as I said, in that trigeminal neuralgia, patient had come down with violent frenetic pain and you gave aconite 30, for example, for 1 or 2 days, and the remedy helped him a lot. He said, doctor, you given a wonderful remedy. It worked very well. But after 10 days or 15 days or 1 month, the same picture will turn up. And your aconite again helps that patient. But when you didn't administer a chronic remedy in that interval of time, these acute conditions will keep on repeating. And at one point of time, your aconite will not work for that patient. So, dear friends, in all these sort of acute conditions, in acute phases, you may need one remedy. And when that remedy helped that person very much, be prepared with chronic remedy, taking the entire case in a detailed way, like what Hahnemann had said from the 84th aphorism, and give that chronic remedy after once the acute condition was well settled. And you will be astonished to note that all these repetitions will be calmed down after giving that chronic remedy. And that chronic remedy, that complementary remedy may vary, but usually for aconite, in 70 to 80% of cases, sulfur is its natural chronic and complementary. For belladonna, it is calcarea car, the natural chronic and complementary remedy. Like these, there are so many remedies which are complementing each other, which are complementary to each other, which will give us this path, this knowledge which was given by our own masters, helped me a lot and all the homeopathic fraternity till today, because they noted down the observations. So, dear friends, you also make a note of each and every prescription you make. Not only the positive results, but also the negative results. Why this thing? Why this in this case, aconite didn't help? Suppose, make a note that will make you evaluate a little bit. Otherwise, whatever knowledge we have, we keep on giving remedies one after another, and it will give us at one point of time a saturation. Am I really helping through homeopathy? So make a note of each and remedy, both positive and negative. Positive, it's okay. Negative, learn more. Keep on studying, improve yourself, go through the ideas of Kent, go through the idea of philosophy of Kent, go through the lesser writings of Kent and Hahnemann. Get a more deeper understanding about the homeopathic philosophy. Okay, right. So the complementary remedy, another complementary remedy is coffea. In fever, sleeplessness, and in pains, coffea is very much wonderful remedy in these sort of cases, along with aconite. But usually the coffee cases are indicated with sudden joy or sudden surprise, not like a fright. In one of my coffee cases, I want to share to make you know that it is a lady actually of a farm. So she came down with some violent pains, headache, etc., rheumatic pains. So I asked what happened, why did all these things came? So she said that on one fine morning, they are digging a well from the past 1 week to have a water in their farm, in their land. And the water didn't turn up. But when they touched about 50, 60 or 100 feet, suddenly the water had come down unexpectedly. And this keep on her very happy, and she was in ecstasy. She was in joy, dancing. But once that phase was over and she returned to the home after that thing happened, she caught up with this idea of sudden violent headache, feverish feeling, pains all over the body, joint pains. And she came to me after one day and she was still suffering with this thing. Coffee at 201 dose kept her calm within a matter of 8 hours. A beautiful case to understand the heart of coffee. So in like that, there are many indications, many similarities between aconite and coffee. The only thing differs is the coffee has this fever, sleepless pains, but with a causation of something happy, something joy, something unexpected joy. Whereas for the idea of aconite, it is usually coupled with something violent, fright, fear, like these things. That will be unexpected fear, unexpected bad news, like gelsemium from effects of bad news. So you all know gelsemium. It has this idea of bad news, complaints from bad news. Suppose somebody died at a far village and someone called this gelsemium patient, and immediately this gelsemium patient will have palpitation, will have fear, will come down with violent diarrhea. He will keep on passing stools. Such sort of thing you observe in gelsemium. But aconite will not be like that. The aconite condition is slightly different. It is also having this idea of bad news, but immediately he was down with some violent inflammation. He will catch up fear. In one of my patient case, so a lady who was my patient for other rheumatic conditions, she suddenly saw a snake and she immediately caught into a shock and she keep on weeping, tossing up, fear, fright. She is not into our own world still. And the daughter of that particular lady immediately called and asked me, brother, what should we do? She is like this, mother is like this. Can you help me? I said, aconite 200, one dose, immediately keep on the tongue. So after 10 to 20 minutes, the lady came into our own world. She is calm, she is quiet, she stopped weeping, she attended to her regular domestic work. So such will be the case in the aconite fright. But gelsemium fright, it is a different thing. So fright is common for many remedies. This is the hindrance with repertory also. Even if you see repertory, ailments from bad news, ailments from fright, there are number of remedies. So materia medica will help you to get us understand that these minor differences with the same causation. If you study only repertory, at one point of time, you cannot understand what is the sickness and what is the reaction and what is the response of this fright to this particular remedy. So too much relying on repertory is not good thing. Repertory study is very good thing, but you have to couple it with organon and with materia medica. Simple repertorization in a mechanical way will not help. Kent says in his repertory, in his lesser ratings, that the repertorial study should be done in such a way, in an artistic way. So in preface, in introduction, he uses the word in Kent repertory. Please study the artistic way of using repertory. It is not a simple mechanical manual way of doing repertory techniques, but in an artistic way. This should be dealt by the homeopath. Okay. Nux vomica, diarrhea from anger. So Nux has this diarrhea. Okay. And bryonia, effects of cold in dry winds. So, but different. Bryonia is very much different from aconite. Aconite is a speed, stormy, and for bryonia, everything is slow and insidious onset. So today morning, there will be slight body pains. Afternoon, there will be a slight headache. And evening, you will show 99 temperature. And tomorrow, there will be 100. and the person is up to bed, he will not come, he will not be raised up, wants to lie down, there is dryness of mucous membranes, he wants to tie his head with bandage, and at next day evening the temperature it will come down with 102. So it will take about 48 hours to come into that picture, and that 102 will come in 1 hour for aconite. Such violent stormy nature is in aconite, such slow and insidious onset will be there in bryonia. So I didn't put the entire case examples because I want to just emphasize on the idea. So a case of fever of 60 years male. So here is a guy, he's about 60 years. So he caught down with some violent fever about 101 and he called up. And he said in phone that I had got fever. So it is in midsummer. So I asked what happened from today. So yesterday it is okay. I took some only white rice, no outside food. Everything is okay. But what had happened today is my mobile didn't work. So for about 1 or 1.5 hours, I went to a mobile shop. And there is something, a prolonged problem with that mobile. So the shopkeeper had asked me to sit for a longer time, around 1.5 hour in that shop. And that in that shop, the AC was extreme, too much in that. And in that AC itself, I felt some shivering. So immediately after coming down from that shop for almost 1.5 hour to 2 hours exposure, I was down with this fever and it was 101. There is throat pain, there is chilliness, there is trembling, there is shivering, all these. So immediately I gave him Aconite 201 dose, and within a short span of 2 to 3 hours, the fever was come down and he was perfectly well by almost 10 to 12 hours. So such is the nature in the aconite. So a case of a fever with leukocytosis of 30 years male. So this is a guy who had called me. He lives in some other part of Andhra. So he called me one morning that he was down with fever. Sir, please do something. This is first version of this person. Sir, please do something. So I said, what happened? I am having fever. So what happened actually? No, sir, I am perfectly well till yesterday night. Today morning, just I went outside. So what happened outside? I did some garden work in some hot summer, in some heat. So how much time? Around 1.5 to 2 hours I did that garden work, and the sun is so bright in midsummer around May. So I did all this summer and I was down. Is it headache? No headache. And there is immediately I called one of my technician who resides by my home and went down, and I had a WBC count of around 14 to 15. So I had leukocytosis, sir. Is it not a problem? Sir, please tell me. Please do something. Am I going to die with this leukocytosis? Sir, please tell me. All this happened around from morning 6 to 10, 10:30. He did some work, went down with fever, called that lab technician, half an hour reports. At 10:30, he called me. 4-5 hours time, 102 fever, leukocytosis, fear, death, frenzy, violence, stormy, everything. Sir, am okay? Am I okay? Leukocyte is not big thing, you know. Sir, is it okay? This is the way the person was asking me. Death, the fear of death is depicted on his face. The mode, the body language, the violence, everything is on par with aconite. Aconite 1M one dose was given. And by 2 to 3 hours, as I knew that patient who is extremely anxious, so I asked him to report after 1 to 2 hours. So after 2 hours, he said, sir, temperature came down by 1 degree, a little bit. So I asked, how is your mental condition? So he said, okay, sir, a little bit better. Fear came down, restlessness came down. I am sitting, I took some milk, etc. So then I knew that, okay, you call anything urgent, you can call in the evening, otherwise call tomorrow morning. By tomorrow morning, he said, I am absolutely well. Such is the nature of aconite in its acute indications. So a chronic case, now the third case of a chronic anxiety neurosis. So here is a lady of around 40 years who was all time harassed with her husband. Husband is suspicious, husband is a little bit angry, who used it to control her, who used it to not cooperate with her with any regards, a very disturbed relationship, 2 children. Always this lady was keep on humiliating by husband and mother-in-law. She keep on crying, weeping with the mother, etc. This is the history of that particular patient. But at one point of time, she was down with rheumatoid arthritis positive, diabetes, hypertension, etc. I never thought of aconite in this condition. But what had happened to this lady is, there are periods of violent aggression. So at that moment, suddenly she recollects something from the past or something happens, and she was in so much a frenzy that she will not close the door of the bathroom. Even that makes her claustrophobic. Fear that at that point she was going to die. It will be lasting for even with remedy or without remedy for about 1, 2, 3 hours. And after that time, she was okay. She don't know when these symptoms will come. It may come in once in a week, once in a month, etc. But from the past 3 months, she was experiencing these sort of things. So I asked, at that point, what happens to you? So she collects something which had recollects something which had happened in the past, a humiliating thing, and at that point she comes down with this violent, impulsive, anxietic attacks. So, as I said earlier, I gave aconite in that acute phases. So first aconite 200 had helped, then aconite 1M, and now she was on aconite 10M, gave almost 6 months back. And now I am preparing her for the chronic remedy which has to follow this aconite, because the panic attacks were very much decreased, and now the time had come to give her the chronic remedy which has to be followed after aconite, and which may help us hopefully in all her impulsive anxiety neurosis problem. So this is actually a case solved by the sensation method, not by usual materia medica understanding, which we will be dealt at the later part, in the last part of our discussion. So another well-indicated remedy is Pulsatilla nigricans. You know about that wind flower, the common remedy. So anybody want to say something about Pulsatilla? What are the main symptoms of Pulsatilla? Anyone? Anybody? You studied your first year itself. Okay. What Kent says about this wonderful remedy? Kent says a Pulsatilla patient is tearful, plethoric, and generally has little credit for being sick from her appearances. So, Pulsatilla patients will not be seen as sick people. Such is the, so even in the sensation understanding, this remedy was put in the psychotic miasm. Because this remedy has a lot of thing called secrecy. We all know Pulsatilla has a simple, tearful individuals. But all this sort of thing which they will do is not to get humiliated, not to get mortified. That is the backdrop idea for the Pulsatilla patients. And for this, they appear itself that they are very slow, easily nodding, easily pursued, and in very tearful mood, so that no one will humiliate them. So, fidgety, changeable, and easily led and pursued. So, whatever you said, you go with this dress because it suits more. And Pulsatilla patient likes this dress actually. So, there are A and B dresses. Pulsatilla had a liking towards A. Mother said, take B dress. So, Pulsatilla patient will take B dress. Why? What happened? Is there any confusion? No, I had a liking for A. Then why did you agree to mother? Because mother may scold me. Mother may mortify me in presence of others. So it is better. This is the nature of the Pulsatilla patients. They are easily led, easily pursued. They answer questions only by nodding. You like ice cream? What is your name? Tell. This is the Pulsatilla's approach in your clinic. Usually, they will answer your questions by yes or no. Usually, they are not seemed like any sick persons, even though they were much sick. They are very much influenced, it seems. But all these they will do so that they don't get hurted by you. Yet she is remarkably irritable. See the latter thing. They are very irritable persons, very touchy. But it is not that Camomilla, Sina, Naxwamica like irritability, where the people are snappish, where they are quarrelsome, like Hepar for that matter. There is no such pugnacity in them. But they are touchy. They are easily get into irritable. But they don't express it. And because of their too much indulgence on their own self, they always has a feeling that they were forsaken. They are offended. They are neglected. You didn't give any importance to me, dear doctor. So such is the nature of the thinking of a Pulsatilla patient. But they seldom express it. Whereas in a Camomilla patient, if you say, tell about your problems, I wrote down in the paper. No, tell about it. How many times, doctor, I have to tell you? I already wrote in the paper. Go and study it. That is the nature in Camomilla patient. Their disposition itself is a quarrelsome. So I like watching thriller movies. So what is in that actually, dear patient? So that what you likes them. I said to you, doctor, what is this type of stupid question you are putting in front of me? I had like towards thriller movies. I said to you, and you are asking why I like them. Wow. Such is the nature in a Camomilla sickness. The people themselves are snappish. They answer in such a way that they will hurt you. They are touchy. And the Pulsatilla is also touchy, but they never hurt you back. they turn inwards, whereas the chamomilla patients turn outwards. The response is quick. The pugnacity is there. And another good modality for the Pulsatilla patients is that they are ameliorated by walking in the open air. They are much better by walking in the open air. So, the mind of a Pulsatilla: consolation, amelioration, soft, timid, dependent, weeps easily, easily influenced, weeps while telling her problems, whereas in sepia, it is not like that. Changeable moods. When you ask questions, then only sepia will weep. Whereas in Pulsatilla, while telling her symptoms, even small sufferings, the headache part, they will weep. They want to gain your consolation. They want to gain your sympathy. They picture like, whereas when you say to natramor, they never weep. They hate consolation. Consolation aggravates them because of the muriatic element, which will not trust even the doctor. The forsaken feeling, as I said before. So these are jealous people. Pulsatilla often has jealousy. We will never think. But if you give importance to other people in front of Pulsatilla patient, immediately they will get jealous. And the claustrophobia. This is the mind. The generals walking in open air, you all know this. Heat or sun aggravation, cold bathing amelioration. So the aggravation in pregnancy, menopause, so much menstrual thing like Actea racemosa, like sepia. Okay? Suppressed menses. Chamomilla antidotes each other and follows each other. So in some sort of acute complaints, they have this tendency, but they differ a lot in their mental attitude. In chlorotic girls, iron was given heavily and where Pulsatilla acts. So too much, your hemoglobin is low, take on iron tablets and keep on giving, and the moment they become constipated, black stools coming to picture, there is no appetite, there is intense heat, and they always want cold open air, then Pulsatilla will come into your picture. But instead of resorting to these crafty things of using iron tablets, it's always better to go with our homeopathic remedies. Many remedies help us in this chlorotic young girls, like acetic acid, like phosphorus, like Pulsatilla, like manganum, like ferrum metallicum. All these wonderful remedies will help you to boost the iron in these chlorotic individuals. And the iron which was taken by the patient will get assimilated after your homeopathic drug. Argentum nitricum follows well in ophthalmic cases. So in some cases, especially of myopia, so Pulsatilla initially helps very much, and they are often followed by the Argentum nitricum. Tearfulness. Sepia. Sepia is also tearful, as I said before, but Pulsatilla cries when telling her symptom. As I said also, sepia weeps only when questions are put by the doctor. And moreover, sepia has indifference. There is a lot of work pending in the patient's house. She simply sits and looks like that. I don't want to enter into the domestic work, doctor. I want to remain like this. And if anyone tells me about my work, I will get angry, doc. So every cloths in the room were put like that. No cleanliness. lot of work to be done, and sepia sit idle to that work. That is the amount of indifference a sepia woman will have. Okay. So one fever case in this Pulsatilla, regarding this Pulsatilla. So this is a case actually of a child, and which was actually treating by another homeopathic doctor. Fortunately, that doctor was not available on that day. So the patient, because the baby was having fever from past 4-5 days, and he was taking to that other doctor, but still he couldn't cure that case, and that doctor went some out of town. He came to me. So I asked, what is the problem? So this father of that child said that this boy has fever from almost 4 days, doctor, and it is running 4 to 101, 102, and sometimes vomiting, sometimes stools, diarrhea. So I don't know what to do. 4 days over, is there any blood investigations we have to take? Please tell. So I said, tell me one peculiar thing you observed in your child. One, at least one peculiar, because you are already had a 4 to 5 or 6 remedies to this patient, to this child. As a father, as a you observe, tell one. So this guy said, doctor, one peculiarity I observed in my boy is in these 4-5 days, he hardly drank at least 1 cup of water. And the urine is a little bit scanty because he is not drinking water. So this, because I too was confused actually. Already 4-5 remedies was given, and the doctor keep on changing the remedies. The patient was not improving. So I too don't know what to do in such sort of case. So I put back the thing to the father only. What is the peculiar thing you observed? He said that the person is absolutely thirstless. This surprised me, because running temperatures 102, 102, usually there will be some sort of dryness. Patient may get dehydrated, may feel dehydrated, and he wants to hydrate himself. And this itself was absent. And along with other modalities of want to have some ice cream in that fever, want to have some open air, want to sit in AC or open air, even in that thing, no chilliness. I gave him Pulsatilla 200, 2 doses in a span of 12 hours or 8 hours. Sorry. And the child was absolutely well after 24 hours. A little bit of cold and cough was remained for 1 week, but his fever was come down within 1 day. So the thirstlessness, you know, the trio of thirstless remedies, the epicock, which was perfectly thirstless, the apis, the Pulsatilla. So this thirstlessness is the peculiar modality in this case, which helped this boy to get cured. So sometimes the modalities will play a key role. Please observe to them. And this is a chronic case of PCOD, later conceived with Pulsatilla itself. So this is a girl, actually the same symptoms which we discussed in the mind section. So whatever question I am asking here, so did you complete your studies? So what is the name of your husband? Please tell me. Srinivas. What? Srinivas. So like this, from the day one, the first question, she is absolutely slow, absolutely insidious, soft, mild, gentle, not getting conceived, doctor. Almost 1.5 years over, weeping. and coupled with other modalities, no thirst, wants open cold air, always sits in her balcony, and with few doses of Pulsatilla 200, she was conceived in a span of 6 to 7 months, and she delivered a boy child wonderfully. So such is the idea for Pulsatilla patients. So I am not going to discuss in detail, because the same thing which we dealt in the mind chapter, we dealt in the introduction, the same symptoms I observed in this particular PCOD case, and later she was conceived and also delivered a male baby. So the third remedy from this group is Staphysagria. The common name is Staphysagria. Kent says that Staphysagria patients are highly excitable, easily aroused to more than Pulsatilla. He will get angry within a short span of time. But as I said, along with other team members of Ranunculaceae, they are not irascible. They will not quarrel with you, but they will be disturbed and excited, but seldom never manifest their anger. Suitable in cases where complaints from pent-up wrath, so lot of suffering, lot of difficulty in their heart. The story itself makes the doctor weep. Such is the Staphysagria stories. Anger, feelings, the person becomes speechless from suppressed indignation. Working from 15 years, doctor, every day the boss will keep on humiliating me. Such is the nature. So I have a very bad husband. And from the past 15 years, every day there is a mental torture, doctor. And I cannot raise my voice. So don't think it is one gender. Sometimes there may be male Staphysagria patients. It is more common nowadays because there is more feminine attitude. So the male patients come sometimes, happens. So the pale patients may same with the same idea that they are under severe indignation. The wife humiliates them every day, sarcastically point out them. And especially if the wife belongs to from animal remedy, like lachesis or epis or other remedies from the animal kingdom, then there will be a huge torture for these male guys. And you will see, you are not surprised to see that there will be Staphysagria patients in male persons also, and will, to my understanding, it will keep on increasing in the future, if I am not wrong, because of so much feminine thing coming upon. So the idea of male Staphysagria is also coming into picture these days, along with the older version of female Staphysagrias, where the males continually use it to dominate them, and they keep on suppressed their feelings, suppressed their indignations, suppressed their humiliation, suppressed their mortification for years together, and they are perfectly fit for this sort of prescription to get Staphysagria to them. We will deal in the case examples. Complaints brought on their causes. Irritable bladder. It is a usual. Honeymoon cystitis is one of the beautiful thing of Staphysagria patients, where you see Staphysagria indicated too much and very much in these honeymoon cystitis cases. So complaints brought on by these causes: irritable bladder, frequent urge to urinate, lasting many days, suppressed wrath after insults, great indignation about things done by others or by himself. It is not only others that hurt Staphysagria. If Staphysagria hurts other people unknowingly, or he or she may say a new word, For example, he say, you don't know, mister? It's a simple thing, silly thing. Even that thing you don't know. What a pity. Suppose he or she said this thing. And this will keep on repeating in this, he or she Staphysagria. Oh, I said this thing to that boy. It may humiliate me. Oh, how is it? I did a lot of mistake. I did a lot of wrong. Oh God. Such will be the thinking. It is not only that they felt indignated by the others, they themselves may feel this, that I did some this to that patient, and they keep on indulging in that thought. Okay. So the mind, the sweet suppressed patients who draw our sympathy, patients, when they approach us, we will see that we feel emotional with their symptoms, with their facts, with their emotions. If we are not perfectly ideal in our emotions, balanced in our emotions, sometimes these things disturb us also. Such is the sweetness of these patients. Ailments from grief. So there are a lot of grief ailments. Patients with history of multiple grief over many years. So multiple grief will be there. So many things had occurred to them, and they couldn't keep the mind out of that things. Such is the nature of mind of the Staphysagria patients. Ailments from suppressed anger. In fact, they want to give something retort back, but they always withheld them. And this suppression will bring on a huge pathology on their level. Ailments after humiliation. They keep on saying this word. I am humiliated by that person. I am humiliated by this person. I am humiliated by the third thing. Like I am humiliated by the street vendor. I am humiliated by the husband. I am humiliated by the boss. I am humiliated by my co-sister. Keep on saying these things. Humiliation, humiliation, mortification, etc. And this will keep their confidence much low. Low self-esteem, depression, high sexuality, and usually indulges in masturbation. And what happens in Staphysagria patients is they withdraw into their own world, and the sexuality will be with oneself. That is idea for the sexuality in these Staphysagria patients. It's not towards the outer side. It is more towards self-abuse. That is what happens in Staphysagria patients. So the relationship of it. So you all know that the bending double, the famous colosynthesis, and colosynth and Staphysagria are related maximum. There is a trio called colosynth, chamomilla, Staphysagria, as said by Kent. So colosynth, the bending double, we also can see in Staphysagria, especially in sciatica cases, where colosynth benefits so much in acute cases, is usually followed by Staphysagria chronically. In my observation, at least a half dozen cases cured completely of Staphysagria with Staphysagria, initially helped by colosynth. So the premature decay of milk teeth in creosotum. The creosotum, Staphysagria, both has this premature decay. Teeth turn black, teeth turn ugly, teeth turn dirty. So much this sort of thing in the child, the milk tooth itself. And usually the creosotum is a little bit slow process. It will take some months. And first they become yellow, later they become a little dark, and finally black, and it keeps on hurting the person. That is the creosote. But in Staphysagria, it's a little bit fast. There will be a little bit dirty, and soon they become black. Such is the idea in Staphysagria. That is the difference between creosotum and Staphysagria. The styes and tarsal tumors like antim crude, chamomilla, coffea. So the styes and other tarsal tumors because of, and you have to see the mental picture here, not only on the basis of styes, it will not help. The clean cut wounds after operations like arnica. So we have some the repertory understand ailments after operations, ailments after surgery. So arnica is there, calendula is there, phosphorus is there, Staphysagria is there. Give first arnica, then first give that. No such thing will not do good. See the sickness, what actually happened. If it is more muscular, a lot of soreness after surgery, not the physical wound, then there is a fever, then arnica will be the remedy. Soreness of the body, touch aggravation, sore bruised state of the whole body. Definitely arnica will improve, arnica will come into picture. Secondly, if the remedy is more lacerated as is surgery and there is more pain around that area, the lacerations will pain, he could not stretch, then calendula will be the remedy. And if it is more well versed with the chloroform fluid, a general anesthesia, vomitings, then phosphorus will be the remedy. And if even calendula is not helping, there is a starch pain, lancinating type of pain, even after 2, 3, 4 days at the point of surgery, then your remedy Staphysagria comes into picture. So you have to search for the nature of sickness, not the causation. A case of amenorrhea. So this is a beautiful case and one of my favorite cases. So this is a lady actually came with complete amenorrhea for almost 10 years. So she was married, no menses now. So the allopaths said they couldn't do anything as there is no appearance. They given steroids, hormones, etc., but nothing had helped. So one of the patients of mine in Hyderabad had referred these persons and they came from straight away traveling 500 to 600 kilometers. And what I found peculiar in this case is, before this onset, what had happened is the lady has to live with the husband's family for a 15-day period. So it was an unfortunate incident. They were not married, husband and wife, but due to some Aadhaar card issue, the lady came from her hometown, resided with husband and with mother-in-law and father-in-law for 10 to 15 days, and she went back. Unfortunately, what had happened is, from that time, the menses didn't come for that lady. There is stoppage of, there is amenorrhea, complete amenorrhea. And all the people in the vicinity, it is a small village, keep on telling this lady that there was something happened with that guy, with her future husband. So she was not getting menses. She may be carrying, she was conceived like this. And this hurted her a lot. She was humiliated by that village people. Every day, one or other person coming and say, are you conceived? Before marriage itself, like this sarcastic way. This keep on increased her in mind. And there is a complete stoppage of menses for almost 10 years. And allopaths couldn't do anything. This was the history given by the patient. So this is the first time in my life gave straight away higher potency. I gave her Staphysagria 50 ml, 1 dose, and asked the people to wait. After 1 or 2 months, for the first time after 10 years, menses was established. And from that time, almost 1 year, the menses was regular. And again, after 1 year, there is some paucity. So I gave Staphysagria CM 1 dose and observed them for almost another 6 to 8 months. And they were perfectly well, the couple, and the patient was doing extremely well. That is the beauty of homeopathy, where even allopathy couldn't do anything. They completely raised their hands like this. We can't do anything. And homeopathy had breathed life into that person's life. Such is a beautiful case, one of my favorite cases. And other thing is a case of interscapular rheumatism. So it is a case, it is my own case actually. So in one of my friends group, WhatsApp group, we had a small discussion about one tennis player. She was a good tennis player, but she was keep on supporting Pakistan. And not supporting much the India. So there was a small clash with messages in our group, childhood group. So one of my friend, classmate, was in support with this girl. So he said that everyone has her own interests and she may like Pakistan, although she was living in India. So indirectly she married Pakistan guy. She supported their cricket team. She was wearing a burqa there and she was wearing other fashion designs here. So this sort of short argument happened in the group. And I was strongly against this girl and I was keep on pressurizing the other girls through other friends through the messages that this practice should be stopped in India. And all the Indians should stand support to India only regarding their caste, creed, religion, this sort of short argument. So finally, what had happened is I was down with the right intercostal scapula pain. I couldn't raise even my hand, move the hand. So I took belladonna, some other remedies for 2-3 days, and I have to go to clinic, but nothing worked for me. So after 2-3 days, I introspected myself. What was happening with me? So all this was happened on Sunday night. So what has happened on Sunday? Sunday evening, we had this discussion. So it was keeping on mind that this sort of discussion should not happen with me as I am a homeopath doctor. I was in service only. I should not deal with these sort of ugly things. Still, I did some discussion with those guys, which is not a good thing on my part as I was open to all members. It's not my job, my cup of tea. So I was unfortunately entered into that discussion. It's a foolish thing. Like I introspecting myself from the past 2 to 3 days. So the remedies on the physical level didn't help me. So this great indignation about things done by me was at the backdrop. And I found myself that I will come under Staphysagria. And I took, without any prejudice, 1 dose of Staphysagria 200. And immediately after 1 day, the pain completely, not 50 or 70, completely vanished away. So such is the beauty of the understanding of these sort of remedies. Okay. Hope you all are with me, I think, because the time is too short and I am moving a little bit fast. Are you there? Okay, shall I go ahead, dear friends? Okay. Now, the another remedy from this group, from this family, is Helleborus niger. It is called as Christmas rose as a common. Kent says, in all complaints of Helleborus, stupefaction occurs in greater or lesser degree. Sometimes it's a complete stupor, or sometimes it is a partial thing. But stupefaction will be there. And it is a sluggish. It may be stupefaction or it may be a sluggishness. Helleborus is useful in affections of brain, spinal cord, and in general nervous system and mind, but especially in acute inflammatory diseases of the brain and spinal cord and their membranes, and in troubles bordering insanity. So this is the chief region where our Helleborus will go on help for us. The brain and spinal cord diseases. It may be insanity or it may be a physical inflammation. The extreme state is unconscious, like opium, like ginkgum metallicum. The opiums, the ginkgum mets, the Helleboruses, all are at one point may reach this unconscious state. The patient lies upon on the back, eyes partly open and rolling the head like this on the pillow. They will do like that. It may be due to the physiological irritation in the brain, or it may be due to the mindset of thing. But they keep on rolling the head in the pillow. Such is the restlessness in the brain happening. And the tongue is open. The mouth is open and the tongue is dry. The eyes are completely lusterless. There is no light in them. Dry eyes. And they stare into space like that, as if there is no one around in the vicinity. A complete unconscious state. The eyes may be closed or opened, but there will be a stupefaction. Nothing will go into their brain and nothing will come from their brain. Both sensory and motor systems are affected. Stupefaction, mental dullness, weak memory, complete blankness of the mind, difficult concentration, and apathy and indifference. So the relationship with other remedies. So the brain and spinal cord diseases, as we discussed earlier in our session, the past session, the stramonium, but it is wild. There is wild delirium. It is more passive delirium. Acid fast also has this, but they can be aroused. It's not a complete stupefaction. It is an apathy. It is an indifference, but not stupefaction, but not a complete blank, but not a complete unconscious. But acid fast has some apathy and some sort of dullness, but not to that extreme as Helleborus. Hydrocephalus, one of the diseases where zinc and Helleborus run close. But zinc has this fidgety of legs. They keep on moving their legs in those sort of hydrocephalic cases. with other symptoms. But Helleborus is complete stupefaction. There is a complete absence of motor nervous system, even though there is a small jerking on one side partially, but that to be also very minute, occasionally seen. Whereas in zinc, there is a continuous movement of the continuous jerking of the or continuous fidgety of the legs. This is the way we have to differentiate between Helleborus and Ginkgum metallicum. And opium has high stupor, stertorous breathing. He will do breathing stertorous. Even often you see the snoring type of respiration in opium, and that is absent in Helleborus. And opium has hot sweats on the face, on the forehead, but Helleborus has not such sort of thing. So these differ in this set. So the first case I am going to discuss is an head injury. So this is a case actually of an old man of about 55 to 60 years who unfortunately fall into a pit in his own agriculture land. So he fall into that pit and he received head injury. And after that head injury, there is a loss of blood, and the family people had moved him to some allopathic hospital, and they did some acute emergency and they sent him back. So he was good for some period of time, and again after 4 or 5 months, the same person fall into the same pit which was dug in his farmland, and he again fall into that and received the head injury by that cement thing. And again they took him to the allopathic hospital. There is some blood loss, and from that second injury, this person was physically okay. He sits like this, listless, and if you say go brush, the wife will say brush. He say like a robo, brush it. She should say 10 times. He will brush like 10 times. Then she will give towel and says, go and bath. He will go to the bathroom and stands there. You should take the mug with the water from the bucket and you should take a bath like this, she has to say. And he will do that. You should eat like pudding like this. So that is the state. No ideas, no sharing, no talking, no communication, absolute blank. So the parents, relatives, the wife approached me and they brought this person. And when I asked his name, he's simply staring into space. Multiple times, no answer, absolute no answer. But he's opened his eyes, he's seeing me, but nothing is going into his mind. So I started treatment with Helleborus 200, and I gave him almost 6 to 7 doses in a span of 4 or 5 years. And with Helleborus and later 1M, he was completely okay. Now, after that period, he is going back to his farm. He is doing agriculture, implementing new techniques, and he is thinking how to improve financially, what crop will be there good for this type of tropical climate, which fertilizers I has to use, and all this had came back after Helleborus 201M, and this person was absolutely enjoying his health. This is thing in chronic state. So with the time, I will skip that example, second example, because we had very less time. So Actea spicata, the baneberry, it was called the common name. So It is indicated mainly in rheumatism of small joints, usually the wrist joints or the finger joints, small joints. Patient may not say the small joints, he may say the hands and legs pains. You should ask where exactly the pain was, and then he will say like this. Please keep on mind. Don't expect that everything which was there in the text, patient will come with same knowledge. That will not happen. So here also you see the absent-mindedness. So in history, you see all these Ranunculaceae family members. There is a lot of pathetic history. The suppression, humiliation, mortification, insults, anger suppressed. No response for the anger thing like this. So confusion of mind, fearful, fear of loneliness and fear of death, the wrist rheumatism. So that is the idea for this. And here is a patient of rheumatoid arthritis. So she gave a lot of things about the suppression of these things to me at age of 40, straight from the marriage. And she never uttered a word against mother-in-law and husband. She kept on suppressing, and at one point of time, she was diagnosed with RA positive. And the main pains are in the wrists and in the small joints. So for this patient, I gave Actea spicata 30 weekly 1 dose for 1 or 2 months, and later Actea spicata 200. And she was perfectly well. Of course, she was still under my treatment, and she was doing well with Actea spicata 200 now. And in future, I think she may need 1 dose to complete the cure. So Actea racemosa, the black snake root, called as black cohosh, similar to diseases states in the human family, mainly in women in hysterical and rheumatic conditions. So patients suffer from both hysteria and both rheumatism here in these Actea racemosa cases. So there is both rheumatism and both hysteria. Patients will be in such sort of depression that they almost speak a word. They seldom speak a word. Patient is always chilly, and along with that suppression anger, suppressed pent-up wrath, suppressed humiliation, suppressed mortification, the patient is absolutely chilly, and there is severe rheumatism, not only in joints and muscles, but along the nerve course. Okay? So there is a trembling, so there is numbness, so there is jerking, and there is an inability to exercise will over the muscles of the body. Such is, it's not like the Helleborus state or Baptisia state. It is the amount of humiliation this guy had received during her entire life that make her completely indifferent. Okay? And turmoil in the voluntary system with stiffness. A huge turmoil in the voluntary system, and there is a severe stiffness of the all over the body, not only in muscles and joints, but also in nerves. Sensation as if black cloud is settled over her. So this statement does not mean that there should be a black cloud overhead. We have to understand the delusion part. The way these people see things from their life perspective, there is completely no hope at all. Such is their state of mind. They are perfectly out of control. Then no enjoyment, no social interaction, no social thing. And they are okay with it. They don't complain also about that. Okay, I'm like this, but I don't want to do anything. Sit idle in the corner, doesn't mingle with anyone. Such is the idea for the black cohosh. Great depression with dream of impending. Even the dreams also are like that. There is a great depression and there is an impending evil. Fear of closed spaces, the claustrophobia, which we are explaining from the beginning. It will be seen in this remedy also. And the more the menstrual flow, the greater the suffering. Okay. So the relationships, many complaints of the Simsifuga or Actea racemosa are similar to Calophyllum. Mostly the difference will be that there is a lot of indifference, a lot of listlessness, a lot of depression, and a lot of chilliness in Simsifuga, whereas in Calophyllum, which also belong to the Ranunculaceae family, both come from the same order Ranunculaceae, but Ranunculaceae it is Simsifuga and Birbiridaceae it is Calophyllum. Families are different, but the order is same for the both the remedies, and both has a strong affinity for the female genital system. Uterus affections like sepia, Lilium tigrinum, Natramur ignitia, lot of similarities. So here we don't go with the differences because of time. So please remember, study these remedies closely together. And a case of post-menopausal affection in a 50-year-old woman, where there was a huge torture from the mother-in-law, and the patient was completely upset, depression, not taken enjoyment in anything, always wants dark light, dark rooms, utters a single word in social life. So many people in apartment, nobody know her. So many people in the vicinity, she knew nobody. And this case I gave for this menopausal affections, this Simsifuga 200, which helped us a lot, helped her a lot. And finally, she was down very much well from her rheumatic affections and that post-menopausal syndrome. Okay, so we will stop with one case because of time, and we will move to the Hydrastis canadensis, the golden seal. So Kent says it is a slow, deep-acting remedy required in many trophic disturbances where there is emaciation, catarrhal conditions, and ulceration, even malignant, defective assimilation, thinking, empty hunger with loathing of food, sinking, and great weakness. A quick, thick, yellow, tenacious ropey, that is the symptom of hydrastis. Like Pulsatilla, like Kali sulfuricum, like Kali bichromicum, like many Kali salts, a thick yellow nasal catarrh, either from nose, either from mouth, either from ear, either from the vagina, either from the penis. A thick yellow tenacious ropey secretions are there in hydrastis. And old cancerous, old cacatic, easily tired and debilitated persons. These are not like aconite. Once you see the aconite, they are robust persons. Here they are tired persons. It makes the person more syphilitic, more towards the right side of the miasmatic chart of the sensation method. Cancer and cancerous states with pain before ulcerations. A obstinate constipation. So one of my throat cancer cases where the doctors was diagnosed the death within a span of 1 month. So with Hydrastis, that case was dragged on to 1 year and he was perfectly well. He was traveled, he looked a bit relaxed, had a good understanding with other people, with family, especially with after Hydrastis. And he died very peacefully with Hydrastis. So the Ranunculus bulbosa, the buttercup, the common name, worse in cold, wet weather from the atmospheric changes. Lower left intercostal neuralgia. The aggravation by inspiration and lying on painful side. Mind, the restlessness at nights, irritable and touchy, great dejection about things, aggravated summer. So here is a case of herpes zoster of a child aged about 16 to 17 years. And there was an herpes zoster around this rib cage, what you say, intercostal neuralgia. At that point, you say some severe burning eruptions, and she was keep on weeping, tearful mood, and fear about that eruptions. And with all this trio of tearful mood, weeping, intercostal neuralgic affections, and burning, I gave this person Ranunculus bulb 30, 5 pills every 3 hourly, and with 1 dose, she was absolutely well. Understanding from sensation method point of view, the idea of sensation in these Ranunculaceae families. Vexed. These are sensations happening within. Easily excited. Raw nerves. Morbidly sensitive. Electric shocks. Insulted. Dreams of vexation. And the sharp pains. And the reaction is of 3 types. It is of passive, it may be active, it will be compensation. The reaction part, how the person expresses this sensation. So in the passive reaction, we usually have the numbness. Whereas the active part, the reaction may be of active part. That there are the nervous tension. There is inner conflicts. There are many sensations. He may weep, he may be angry, he may be crying. And mixed emotions is one of the keynote of Ranunculaceae. Other sensitive to trifles, passionate, brooding, and outburst. All these will be there in this reaction part of the Ranunculaceae family. So this is the understanding of the Ranunculaceae family from both the idea of the materia medica point of view and a brief introduction from the sensation understanding. Hope you all have enjoyed the lecture, and now I am ready for any doubts which you have in your mind. Please come up. I will try to explain. Okay? Any doubts, dear friends? Okay. So thank you. Thank you, one and all, dear friends, who patiently listened to all my lecture. Hope this understanding will bring a new idea about different remedies of which you had studied in your UG course or PG course, whatever course, or in your practice also. So there are few people who I have to thank in regard of giving me this opportunity. Firstly, the principal of the Vidhyadeep University. Thank you so much, sir. Thank you so much. And the people of Swara Gurukul Academy, Dr. Shekhar sir, who is my mentor, teacher, guide, friend, philosopher, all who had initiated me, who had recharged me, who had directed me on this homeopathic path. Many gratitude, regards to you, sir. And Dr. Priyanka ma'am, and Dr. Divya ma'am, Dr. Kirubashini ma'am, who come from the Gurukul Academy, who helped me, who taught me a lot during my stay at the Gurukul. And the management of Vidhyadeep University, who had took all the pain to organize this sort of lectures. Thank you so much, dear people from the management sector, and also the dear friends. Thank you so much for attending this small session. And finally, Dr. Gautam from the Sankalpa Homeopathy Academy, who had took all the pain to type this thing, who spent a lot of time with me to arrange all these cases and to type all these PPTs. Thank you so much, dear Gautam. Thank you, one and all.
Thank you, sir.